Shoulder pain is very common. We see it a lot here at Spine and Performance. Oftentimes, prior to coming here, people receive a pretty scary diagnosis of rotator cuff tear. And yet the literature, the research is abundantly clear in that people can manage, conservatively rehabilitate, and even get rid of shoulder pain, even in the presence of such rotator cuff tears. We have a great example of that very issue here this morning with Gary. Gary's a very awesome guy. Any given day you might find Gary out pressure washing a home or a business, roller skating for exercise, professionally decorating cakes, or even professionally playing just about any stringed instrument that you can think of, including the banjo, guitar, bass, mandolin. He certainly did not have time for shoulder pain.
Back in February this year, I tore my rotator cuff in my left shoulder. I went to a doctor from Lexington. He gave me an injection. I went back again. He told me that I was going to need surgery on my shoulder. They did an MRI, showed a tear. So I got to the point to where I couldn't raise my left arm up, couldn't pick a cup of coffee up, pretty much couldn't use it to do anything. And a friend of mine told me about Josh. Now my shoulder is doing great, thanks to Josh.
Gary, when he first came here, he could not lift his shoulder up almost at all from your side, could you?
None.
And even after one or two treatments, we started to at least see a range of motion increase. Are you now able to be back to pressure washing, to cake decorating, to guitar playing? I mean, is all that free and clear now? I'm guessing you'd probably recommend conservative management over going straight to surgery, at least trying it.
Anytime. You just got to stick with the program and let it work.
So there you go, conservative rehabilitation of an MRI confirmed rotator cuff tear. A lot of people that have shoulder pain, they'll have kind of some lower neck issues, and then this upper trap muscle is often tight, and so you can see we're actually getting that upper trap muscle to contract, and then even one into the actual rotator cuff here for shoulder pain and even lower neck pain. Gary, what does that feel like right there?
It's relaxing, it relaxes the nerves, but this stuff is absolutely amazing.